Let's talk about skin picking, excoriation disorder, dermatillomania. My name is Maria. I'm a psychiatric nurse practitioner. I had a lot of requests in my OCD post about addressing this as a topic. So let's talk a little bit. Skin picking is very similar to hair pulling in a way. It is connected with obsessive compulsive disorder, very similar kinds of tracks going on as far as like what we see in the brain. It's not well studied. What we do know is it occurs more in women than men. It often occurs more so with people who have like depression, ADHD, maybe because of that like fidget component. Also like anxiety, substance use disorders can co-occur. Other things we might see with this is like looking for imperfections on your face or in other parts of your body. And when you feel that imperfection, you start picking. And oftentimes that picking will just like continue and continue and continue. People who have this as a disorder aren't like just kind of picking because they're bored or something like that. It's something that can take like hours every day that they like cannot stop. So if you skin pick, but you can stop and like go on with your day, that's not a disorder. This like reaches disorder level when, you have like severe inability to just stop. Like you just keep going. It can be on your scalp. Like maybe if you feel like a little bit of something here and then, it just kind of expands and then all of a sudden you're bleeding. It could be like on your cuticles. It could be on your face. Oftentimes it is the face. It's just kind of like an automatic thing that we touch our faces. And then that seems to be like the most prominent location that a lot of people do pick from. But oftentimes I've seen like scabs on people's like legs and arms. Like I've seen people's entire bodies just like completely affected, right? Like just like scar tissue everywhere from this. And sometimes you can have like really serious disfigurement from the amount that you're picking. Sometimes people who have acne might pick at their acne so compulsively and just can't stop. And it's embarrassing to go out into public, right? Like you are already self-conscious and then all of a sudden you like picked your face because you were stressed the night before. You got like some tension release, sure. But now like you have like more scar tissue and your acne is worse and you have like inflammation on your skin. So it just kind of like contributes to this like cycle of anxiety and social anxiety and embarrassment too. I've seen this pretty significantly in like kids who have developmental disorders, like developmental delays. And I'm not quite sure of the connection there, but I have seen that pretty frequently. One of the things that is beneficial for this, that we know is beneficial, is the supplement NAC. That stands for N-acetylcysteine. This is something that's over the counter that you could start at 600 milligrams twice a day. And it can go up to like 3,000 milligrams daily is kind of like where studies do see effect in that. This is not something that needs to be prescribed by your doctor or anything like that. Although like I will say like in my practice over the years, I have recommended that like countlessly anytime these things come up. And I've seen like good success with it, but I mean, it's not perfect. And I think like combination with that and therapy, sometimes there are other medications that can be tried like antipsychotics and sometimes TCAs, which is like a type of an antidepressant. We also use TCAs sometimes in OCD. Clomipramine would be the one that has some evidence behind it for skin picking.